Hi, my name is Naomi and I am a birth doula. And in my previous video on dads and doulas, I mentioned that doulas offer a distinct role from both dads and nurses and doctors, and that support that they offer is very crucial to making sure that a woman is well supported in labor, and so they're very useful. But occasionally, a doula is asked to leave the hospital during the labor of her patient, and she's asked to do so by the nurse or the doctor who is there, and that's because sometimes a doula does not get along with the medical staff, either by offending them or stepping on their toes and asking the mother to decline interventions that her care providers are asking her to accept. And there are only two reasons why I can think of that as being an issue. One, either the doula is not experienced and she either does not understand her role as a doula, or she is not very good at communicating the patient's wishes to the doctor and nurse. Or it could be because she is trying to accomplish more than what her role encompasses. Sometimes a woman becomes a birth doula because she is what is called a natural childbirth activist. A natural childbirth activist is someone who believes very strongly in natural childbirth. And of course there is a wide range of passion toward that subject. Some people believe that, yeah, natural childbirth is good, but it's not always able to be accomplished by the woman. If she has a complication, sometimes it's necessary for the hospital to do something. And then other times, natural childbirth activists feel so strongly that they feel all women should give birth outside of the hospital and that all medical intervention is bad, or at least in most circumstances that it is bad. I have a quote here from Dr. Marsden Wagner. He wrote Born in the USA, and he's a very well-known doctor and childbirth activist, a natural childbirth activist. He was saying that many doctors don't like having doulas around, and sometimes they'll throw the doulas out, forbid them from entering the labor room at all, and sometimes they will create protocols for the hospital that limit the doula's role. He said, and I quote, "Doulas must walk a fine line between supporting and protecting a woman giving birth and defending the hospital staff. Good luck." He also says that knowing the difficulties of being a doula, quote, "one can't help but wonder why someone would choose a career as a midwife or a doula. When I talk to midwives and doulas, there is no doubt in my mind that it is more than a job, it is a vocation, for some even a calling." I had a conversation with Nancy Weiner, who is a natural childbirth activist, and she wrote the two books, Silent Knife and Open Season, both of which are about cesarean section and VBACs in the United States. And she says that she feels doulas are not changing the way women give birth in the U.S., because even if they are supporting a woman well and fulfilling their role as a doula, they cannot change the cesarean section rate, they can't change the epidural and episiotomy rate in the U.S. Because the women they are working for are still giving birth within that system of medical intervention. Although doulas are proven to reduce those rates on an individual basis, overall we have not seen much of a change, and that could be because doulas are still few in number compared to the number of women giving birth, or it could be because of the wall that women who want a natural childbirth have to face in the medical system. But either way, she suggests a few things for doulas to be able to change the way women give birth, and that includes refusing to attend births at certain hospitals where practices are not natural childbirth friendly, of banning, of working together with other doulas to inform women of different rates within the hospitals of cesarean sections and VBACs. And so you can see that although this is a very good way of helping women to learn about what is truly happening, and that needs to happen, women need to understand what is going on in U.S. hospitals, it also can pose a problem with a woman and her doctor. And so the women need to be sure of who they're working with and who their doctor is, who their midwives are, and who their doulas are, so that they are not going to be fighting against care providers that they don't have similar beliefs with during labor. Some patients some women prefer to have a doula who is very pro home birth, who is very anti-epidural, very natural childbirth oriented, and that's fine. That's definitely a good thing. That's, you know, if you have a doula like that, you're much more likely to have a chance at having the birth that you want, because you have someone there who's got information and who has experience working with that hospital, most likely. But some women also prefer to have a doula who is anti-home birth, who is pro-epidural, someone who is going to encourage them to make the same decisions that their doctor is likely to encourage, depending on the situation. And that's perfectly fine too, as long as you, as the birth-giving woman, understand the pros and cons to both sides of the decision being made. And as long as you are well informed, it doesn't matter what type of birth doula you choose, as long as you understand what her beliefs are. And so that brings me to my final point, and that is that when you choose a birth doula, I highly encourage you to interview a few different women to make sure that you do have similar beliefs as your doula, and that you're willing to back her up, and that she is going to back you up in your decisions, and that she's not going to be fighting for something you're not interested in. And also talk to your care providers and find out what their beliefs about doulas are, because maybe if you have a very natural childbirth-oriented doula and your doctor says, no, I don't think so, that's not a good idea, then that might be a very good indicator that it's time to find a different hospital, or maybe even a birth center. So also, if you have friends or family who have chosen a birth doula, they could be a very good wealth of information on what doulas you should be interviewing. So again, interview doulas, ask questions of different sides of the natural childbirth fence, of women who support it, women who don't support it, and their reasonings and their opinions on doulas. And so good luck with that, and congratulations on your pregnancy.